A disease that requires that you keep pricking yourself every single day of your life. It's a very terrible and frustrating disease. Because of that, today we've decided to talk about one very common disease plaguing both the young and the old, called Diabetes Mellitus. This is the TDJ show. You're welcome back. Don't forget to subscribe, to comment, to like, and then to share. My name is Dr. Josephine Awojukuku. Now let's go to the topic of discussion, diabetes. It is a disease that is associated with high level of blood sugar in your blood. And this sustained high levels actually goes on to destroy your blood vessels and other parts of your body, resulting in various forms of complication. And that is what we call diabetes mellitus. We have two main types of this disease. You have the type 1 and then the type 2. For the type 1, there is something that destroys the pancreas, specifically the B cells of the pancreas that produces insulin. So for these particular people, their body cannot produce insulin, and insulin is what is required to sort of manage sugar in your blood. So if you don't have it, then anytime you eat, the blood sugar level just goes up because the body doesn't know how to make use of it. And in this kind of diabetes, it usually affects the young most of the time. 95% of the time they are very young, and it's mostly hereditary. So most of them have a family member who already has diabetes. So we can have kids as young as 4 years, 5 years coming in with type 1 diabetes. And with this kind of one, they usually have to inject themselves for the rest of their lives. Now we come to the type 2 diabetes. For the type 2 diabetes, one acquires it over a period of time. Most of the time, the risk starts after 40 years. But usually, you get it earlier if some of the things that predisposes you to it, you have it early, like obesity, like, sustained weight gain. We have it these days showing in the young because of obesity of the young. So now we have little children showing or having type 2 diabetes. Now, how does it happen? So the body now does not produce enough insulin or becomes a bit resistant to insulin, and as a result you don't produce enough to handle the blood sugar, so you need help in the form of medication or insulin to handle it. We also have other less common forms of diabetes. We have secondary diabetes. Secondary diabetes, those ones happen as a result of a disease or a drug. So you have a disease that has destroyed your pancreas where the insulin is being produced, or you're having a medication or something that is, interrupting with the production of the insulin. Then we have what we call the secondary diabetes, and we have gestational diabetes, which usually occurs in pregnant women. So the state of pregnancy and its own changes in the body also causes some pregnant women, to have more resistance to the insulin. So now you realize that their sugar levels now starts going up. And if it happens whilst you are pregnant, we call it gestational diabetes. Most of the time after you deliver, your sugar level goes back to normal, but on some few occasions, you can actually go on to develop actual diabetes, or you have a risk of developing actual diabetes later on in future. So how do you know you have diabetes? So to know you realize that you are urinating a lot, and you always feel like drinking water. You produce huge and lots of urine, so there's frequency and there's large amounts of the urine, and because of that, it makes you want to drink water all the time. It also makes you want to eat a lot. We call it polyphagia. You're always hungry, you always want to. Meanwhile, although you are eating, you are losing weight. Now, there's one thing about diabetes and infection. When your sugar level goes up, it puts you at risk of infection. And when you have an infection, it also destroys your sugar balance. So they have this reaction going on. So most of the time when they have the diabetes, now they start having other forms of infection. So some people will come in with, let's say, a pneumonia or a urine infection or a yeast infection and all that. And when you check their sugar levels, then you realize that the sugar levels are high. Now you ask them, are you urinating a lot? They'll tell you yes. Are you eating a lot? They'll tell you yes. So those are some of the things and how you would know that you are likely suffering from diabetes. So you have to go and check from your doctor. So when you come in, your doctor will ask you some series of questions. They will also want to find out if you have any underlying infection because of what I said earlier. Now we'll do some blood work. You have to check your sugar levels. We have some definite range for normal people to be within. So when you go beyond those levels, then after we compare it to some other things, and then we'll know that whether you have diabetes or not. Then we go ahead to treat you. For the treatment, you'll be on your medication or your insulin based on the type, whether you're type 1 or type 2. You should bear in mind that in type 2, gets to a point where you may need insulin together with your oral medication to help, regulate your sugar levels. One thing that is very important about diabetes is education. You need to understand the disease very well. You need to learn how you will control your blood sugars, your medication, the effects, the side effects of every medication you are taking, because bear in mind, diabetes is for the rest of your life. It would never go away. You have to manage it if you want to live and enjoy your life. So you should know that this disease is not going away, so you should understand the disease. If yours is type 1 or you are taking insulin, then you need to learn how you are going to regulate the insulin. If you decide to fast, you can't be taking your insulin regularly because no food is going in. So then the levels will drop, and there are dangers associated with it going beyond, lower than normal. If you have overeaten, let's say you went for a friend's party and you ate too much, you enjoyed yourself, the amount of insulin that you normally take, that will regulate your normal diet, might not be able to regulate this particular level. So the levels will go up. So you need to learn everything about the disease, everything about the medication, and when to adjust when necessary. Anytime you are not feeling well, there will be a disruption in the balance of your sugar levels. That is why we tell everyone with diabetes that it's important that you get a glucometer. A glucometer is the machine that you use to check your sugar levels, so that if possibly on a daily basis, you check your sugar levels so that you know whether you are going down or you are going way up. Now, we have something we call hypoglycemia. When you say hypoglycemia, that means that the sugar level is way lower than normal, which is very dangerous and can kill you in few minutes. So every person with diabetes should understand what it means to have hypoglycemia. You should know the range of hypoglycemia so that when you check and your levels are down, you know what to do. Now, before you even go and check, when you're having hypoglycemia, your body will tell you are having hypoglycemia. Sometimes you'll be having tremors, like you'll be shaking. You see, you will feel unwell. You realize that you are sweating, your heart is beating fast. There are several signs of hypoglycemia. So as a diabetic, it's one of the things you need to learn, so that the moment you start feeling that, then you have to know, am I getting hypoglycemia? You check. If your levels are low, then you have to take in some form of sugar. So then every diabetic should have either a cube of sugar or a sugar drink somewhere close to the person. We are not advocating that you eat sugar, no, but you should have it so that in case you're having hypoglycemia, the first thing you do is to take that cube of sugar or that sugary drink to bring it up. It's easy to bring it up and bring it down than for it to go down, because if it goes down, you can easily die. So it's better to have it up so that you can take your time to bring it down, or to have it going lower and lower. So that is something every diabetic should take note of. You have to read about it. It's called hypoglycemia. When it comes to diabetes, diet is very important. You're supposed to see a dietitian so that you know how to eat, what to eat, when to eat, and the portions to eat. All these things are very important as the medications you take. So, like I said earlier, education about diabetes is very important. Your medications, hypoglycemia, your diet, so that you understand and know how to handle the disease. That's one thing about diabetes. When the sugar levels are high, it affects the vessels, both the micro vessels, that's the smaller ones, and then the bigger ones. Now, based on the destruction, which part of the body it destroys, it can cause blindness, it can cause kidney damage, it can cause heart condition. I know a few of you may have heard that if you are a diabetic and you have a wound, it doesn't heal well. Yes, it interferes with wound healing. And because the vessels, it has affected the vessels there are not good enough, so it doesn't send enough blood for the healing to take place. if you don't take care and all the vessels there are so bad, you can actually have a gangrene, a death of that area of your limb, and then you would have to amputate or cut that whole area off. So we have lots of diabetics who at one point in time or the other have had amputation of a part of their limb. So diabetes is a disease that has lots of complications, but it's a disease when you handle very well, you can live your normal life and enjoy. The only thing is you have to be checking your sugar regularly, checking your diet, and take your medication. However, if you're able to learn and adjust and do these things, you have a normal life expectancy. However, if you're unable to do this and you take the disease for granted, over a period of time, your vessels will be attacked, they will be destroyed, and you'll be having symptoms from time to time. And after some years, you have bad complications which will eventually lead to your death. So, my dear listeners, please, let's be on guard. If you are diabetic or you have a relative or a friend who is diabetic, let's learn all about diabetes. Let's empower ourselves so that we can take good care of ourselves and prevent these bad complications in order to have a better, and a longer life that is full of quality instead of, battling with all sorts of complications. Thank you very much. Any question you have, please kindly put it in the comment section, and then we would answer, because this is very important. I would like to address all your questions about diabetes. Don't forget to follow, to like, to comment, and to share. Thank you very much for listening to the TDJ Show.